Computerized tomography, or CT scan, combines a series of X-ray images taken from different angles of the body and uses computer processing to create cross-sectional images or slices of the bones, blood vessels, and soft tissues inside the body that allow doctors to better diagnose a patient. The donation of the Revolution Evo 128-slice CT scanner to the St. George's General Hospital stems from discussions held in 2019 with former Director of Hospital Services, Dr. Carol McIntosh. Rochelle Roach is the Chief Executive Officer of the Maria Holder Memorial Trust.
The CT scanner will open accessibility to those with limited or no resources, provide immediate diagnosis of emergency cases that present to the General Hospital, including patients with trauma, stroke, deep vein thrombosis, acute coronary syndrome, neonates, and pediatric emergencies, allow for the advancement in oncology cases and the development of the stroke unit and interventional cardiology services. It will allow the General Hospital to support a wide range of medical specialties, including pediatrics, internal medicine, general surgery, oncology, obstetrics, gynecology, and neurosurgery.
Dr. Linwald Fleury is the sole radiologist at the St. George's General Hospital. He says the services will be accessible to all.
We are not going to discriminate financially. We have things in place, social services in place, to make sure that we work together.
Additionally, the Trust donated 2 wheelchair-adaptable buses and 12 wheelchairs to the Ministry of Education, Youth, Sports and Culture. Education Minister David Andrews says more than 160 students with special needs will benefit from the investment of more than $300,000. He said the Maria Holder Memorial Trust will also be providing the relevant training for officials in this regard.
Mobility is a barrier for persons with special needs in many cases. When our special needs students have to use the public transport system, regrettably, they are discriminated upon. Some bus providers, some service providers refuse to pick them up. Sometimes they're hustling and these people take too long to get on board. And they call them names sometimes, regrettably. I mean, I'm not even happy to stand here to say those things, but it's the reality. And so when we get a donation like this, that allows us the opportunity to give specialized attention to train our professionals and our caregivers who are going to interface and interact with them, it puts us in a good place.
Meanwhile, Prime Minister Deacon Mitchell, who attended the handing over ceremony, noted the Trust's valuable contribution to Grenada over the last 15 years.
The Trust has implemented 21 projects in Grenada at a total cost of 14.6 million EC dollars. Lion's share of the investment, 46% of it has been in education and 33% in healthcare.
The Trust works with government entities and registered NGOs in Grenada and other Caribbean countries to implement projects that have a direct impact on the lives of vulnerable people, targeting children, youth, the elderly, and those in vulnerable or difficult circumstances. For GBN News, I'm Nisha Paul.